Today we'll hear the stories of individuals who have dedicated their lives to serving others through providing direct services and supports, through program leadership and supervision, through building best practices and evaluating those practices, and for working in our administration and finance teams. They are honorable, they are compassionate, and they're living their lives in such a way as to make a difference.
In terms of looking at the awardees this year, like the ABH membership, it's more than the sum of their parts. Really our field coming together, working together to better meet the needs of individuals, to offer hope, recovery, resiliency for individuals that we serve. And when I look at the ABH membership, that's what I see. All of us collectively working together to make things better.
I sit down with so many providers and hospitals where they talk to me about how behavioral health and mental health especially is a loss for them to provide. And it is our job in the State House and across the Commonwealth to change that narrative. There is nothing losing about taking care of people with behavioral health.
We're putting about $10 million into the ESP system, but only with very clear goals that we're looking to achieve on that, and to be pretty directive about, both on the hospital side and the overall system side, what we are looking to see in an actual system of crisis care.
I've always felt that public health, we have a particular obligation to ensure that we address the needs of people in vulnerable situations, and many times are unable to advocate for themselves. We know that many of the priority populations that we serve at BSAS, which are pregnant and parenting women, recently incarcerated, men of color, and the dually diagnosed folks with mental health and substance use issues, are our priority, and we need to ensure that they receive better and more integrated care. Those efforts start with you and our service providers. You are the unsung people doing the hero's work on the front lines day in and day out, ensuring that those who are often unable to speak for themselves adequately have a voice, have a chance, and have a pathway.
This is what describes you, all of you who are being honored here today. You refuse to accept the status quo. You apply your passion to finding better ways to reach all of the individuals who are so in need of excellent behavioral health. You reach out for partnerships to do your work. We thank you, not just today when you're being specially honored, but each and every day. Because here's what you show us. You show us that treatment can work, that healing can happen, and perhaps the greatest contribution we can all bring is to continue applying the art of the possible.
So congratulations on your achievements. Thank you all for your commitment in supporting recovery, resilience, and empowerment for individuals with behavioral health conditions. I'm happy to be here with you.
Good afternoon. It's a pleasure to be here with everyone, and it's really an honor to present this award to this team. This team is Jennifer Ferretra, who's a social worker, campus lead for us, and the director of the Tewksbury Treatment Center. Rita Murphy, who's nurse manager extraordinaire. David Blanchard, who's a recovery specialist supervisor. And we also have James Milinarski, who wasn't able to be with us today, but he's a case manager supervisor. I'm going to digress for a minute, because when I was trying to think about who is this team, Jen was one of the first people that I met in the field when I came to BI Lahey Health. And her passion and commitment and potential, you could feel it when you were in the room with her. And it was very clear that she was an emerging leader and someone who could really bring people together. And you have to be careful for what you wish for, because Jen will push you and say, but why? And she and her team push to make things happen. So I have learned over the years to just get out of the way when Jen and her team have decided they want to get something done. So they're getting this award today because over the past 2 years, the city of Lowell has experienced a significant increase in new HIV diagnoses. Both the Centers for Disease Control and the Massachusetts Department of Public Health are now monitoring the situation very closely. Before this outbreak came to public life, the staff here started talking about what was going on and all the new infections they were seeing, and particularly new infections in people who were under 25. And they basically were the first in the community to really start to fully understand the potential that the HIV infection had to spread rapidly, and took some immediate action. They were working with a vulnerable homeless population living in downtown Lowell, where syringes are often shared between intravenous drug users, and access to clean water and other means of maintaining basic hygiene is very limited. They knew that even a single case of HIV could lead to many more if not treated and contained very quickly. With urgency, they immediately reached out to the Department of Public Health to connect with local providers and other community resources to ensure that there was coordinated care for individuals who had both opioid use disorders and HIV diagnosis. So they worked with the Department of Public Health, the Centers for Disease Control, the local Healthy Streets, the federally qualified health centers, really brought together a whole community of providers to treat these folks. Word quickly spread through the community that for those suffering with an opioid use disorder who were worried about testing positive for HIV, that the Tewksbury Treatment Center was the place to get help and access services. To date, the center has treated approximately 50 individuals who are HIV positive, but the numbers would undoubtedly be far higher if they hadn't acted so quickly and compassionately. They have been able to not only help people access HIV care, but support them through a full continuum of addiction treatment while the HIV care is being accessed. For their collective efforts to proactively identify individuals at high risk for HIV and having them tested well in treatment, and then assisting them in continuing with the opioid use disorder treatment and connecting them to HIV care, the staff at Tewksbury Treatment Center has attracted the attention of the Substance Abuse and Mental Health Services Administration for developing a model program to treat people with both of these disorders. I am proud and delighted to present the Tewksbury Treatment Center team with this Excellence in Best Practices Award.
Thank you. I drew the short stick because I'm not much of a public speaker, so forgive me. But so 2 years ago, the staff at the Tewksbury Treatment Center began to witness a younger generation arriving to our program with a recent diagnosis of HIV. It began in October of 2017 with on two consecutive days, 2 young men were admitted to our facility. We immediately knew that this would not be the last. The management team began to brainstorm on how we could best tackle what we thought would be an emerging trend. Knowing what we know about our clients' culture and behaviors, we projected many more clients would emerge with an HIV diagnosis. It was also apparent we would have clients in our care who were unknowingly HIV positive. With the help of various community providers in the Merrimack Valley, we were able to develop a comprehensive plan of testing and treatment. It is our philosophy at the Tewksbury Treatment Center that we do more than detox people, we treat them. ATS is the first point of entry into the inpatient substance use treatment in the state of Massachusetts. We often refer to ATS as ground zero. Since October of 2017, TTC has treated 48 HIV positive clients, some receiving their diagnosis while in our care. With the collaboration of various community providers, we continue to support our clients in accessing the treatment to treat their new HIV diagnosis. First, we would like to thank ABH for acknowledging the work we are doing at TTC. The population's health care and SUD treatment are paramount to our team. We never imagined we would be receiving an award for doing the work we all love. We would also like to thank Beth Israel Lahey Health Behavioral Services for their support in this endeavor. We have been given the flexibility to rethink ATS level of care and what it means to service a disenfranchised population. The work we are doing would not be possible without our collaboration with Healthy Streets, Mary Wheeler, and her team. All it took to set up testing in our facility was one phone call. As soon as we notified Mary of a public health concern, she deployed a team of employees to our center, and we began testing. In addition, our success would not have been possible for it not been the open minds of the Lowell Community Health Center. The staff at TTC has formed relationships with Lowell Community Health Center, and we are now able to access HIV treatment in a seamless fashion. Janice Bryant at DPH has also been instrumental in educating us on how to best access care. We would not have been able to navigate appropriate HIV treatment had it not been for her help. We are grateful for her and the hours she had dedicated to assisting us. But last but certainly not least, I'm sorry if I get choked up, we would like to acknowledge Rita Murphy, the nurse manager at TTC. She has dedicated her life to this work. She puts countless hours on a regular basis to ensure the clients at TTC receive the most comprehensive care possible. I am beyond proud to have her as my right hand, and without her commitment, none of this would be possible. Thank you.